Welcome, neurology residents. So, you're stepping into your residency, and you've probably heard some whispers about the ACGME milestone system, right? It might seem like this daunting, complex matrix at first glance. But hey, don't sweat it. In this explainer, we're going to completely decode these neurology milestones. By the end of our time together today, you're going to confidently navigate your training, knowing exactly how your progress is tracked and supported.
Okay, let's look at exactly what we'll be covering in today's review guide. First, the purpose of milestones. Second, decoding the 5 levels. Third, levels versus training years. Fourth, milestones in clinical practice. And finally, reaching the graduation goal.
Let's jump right in with Section 1, the purpose of milestones.
So the absolute most crucial thing to wrap your head around is that these milestones are simply a framework. They're here to assess your development in key competencies. Think of them as formative targets, not some high-stakes pass or fail exam. The key word here really is formative. They're literally designed to show you exactly where you stand and what specific skills you need to tackle next to become a fully capable neurologist. It's all about continuous quality improvement, both for you as an individual learner and for your educational program as a whole.
In fact, the ACGME documentation actually spells this out perfectly. It explicitly states that these milestones cannot be used as a sole assessment for high-stakes decisions, like determining your eligibility for board certification or credentialing. No way! You should absolutely be viewing this whole system as a dynamic roadmap for your professional growth, not some kind of punitive grading system designed to weed you out. Remember, it's a roadmap, not a roadblock.
Decoding the 5 levels. All right, so the milestones are broken down into 5 distinct levels. Moving from level 1 up to level 5 is essentially synonymous with your progression. You're leveling up step by step as you demonstrate increasing competency. You start at level 1, which is basically the novice resident who's just getting their bearings and demonstrating basic knowledge, but as you gain experience, you'll cruise through the intermediate and advanced stages of levels 2 and 3, building right up to level 4, which is the graduation goal. And hey, maybe you'll even push into the highly advanced level 5.
Now let's look at how this actually plays out during an evaluation. During your semi-annual reviews, the Clinical Competency Committee doesn't just force you into one strict, rigid bucket. See those little response boxes on the line in between the main levels? Selecting one of those means you've substantially demonstrated all the milestones in the lower level, plus you are actively acquiring some of the milestones in the next level up. It's actually a really nuanced system. It perfectly captures your gradual day-by-day acquisition of complex medical skills.
All right, Section 3, levels versus training years. This is a big one.
We need to be crystal clear about something here. Your milestone level does not automatically match your postgraduate year of education. You aren't just magically expected to be a level 1 in PGY1 and a level 2 in PGY2. It doesn't work like that. Depending on your previous experience, a junior resident might actually hit higher levels really early on in certain subcompetencies. On the flip side, a senior resident might find themselves at a lower level in a super specific skill later in their training, and that's totally fine. Everyone's timeline is unique.
And here is something that honestly shocks a lot of residents. Regression is completely normal. There is no predetermined clock ticking to reach a specific level, and your performance stats might actually drop temporarily. You might go down a level between evaluations. Why does that happen? Well, maybe you were overscored in a previous review, or maybe you just had a disjointed experience where you didn't get to practice a certain procedure for a few months. Listen, regression isn't a failure. It's literally just a recalibration of where you actually are so you can get the exact support you need.
Let's transition to Section 4, milestones in clinical practice.
Let's ground this with a concrete example, like the lumbar puncture. Notice how the progression here beautifully maps out your journey. Down at level 1, you aren't even touching a needle yet. You're just listing indications, contraindications, and potential complications. Makes sense, right? Then by level 2, you are performing the procedure, but you've got direct supervision. At level 3, the training wheels come off. You're doing it without direct supervision and handling standard complications yourself. Finally, at level 4, you are expertly performing LPs on patients with challenging anatomy. It really shows you exactly what's expected at every single stage.
We see this exact same logical build with another critical skill, the EEG. You start off at level 1 simply by identifying which patients actually need an EEG. Pretty straightforward. Then at level 2, you're learning what normal looks like and spotting common artifacts. But by level 3, the stakes get higher. You need to start recognizing critical patterns like status epilepticus. And finally, at level 4, you've leveled up to confidently interpreting common abnormalities and patterns totally on your own. Every step just builds right on top of the foundational knowledge from the last one.
Which brings us to our final part, Section 5, reaching the graduation goal. So, hitting level 4 is your graduation goal. Reaching this mark across your competencies essentially means you are fully equipped for independent, unsupervised practice. But, and there's a really important caveat here, level 4 is a goal. It does not represent a strict graduation requirement. The ultimate final decision about your readiness for unsupervised practice always remains the purview of your program director. They use these milestones to guide them for sure, but they make the final call based on your holistic performance.
Now, while level 4 is your main target, representing a doctor who efficiently gets a hypothesis-driven history and manages common and uncommon disorders, level 5 represents the beyond.
This is designed for the resident whose achievements in a specific subcompetency are way greater than expectations. This is the resident who serves as a true role model in the clinic. They're educating others, they're leading the management of the most complex conditions, and they're actively driving quality improvement at an institutional level. It's the absolute expert tier.
As we wrap up this explainer, I want you to take a second and reflect on your own starting point. Every single resident enters with completely different background experiences and strengths. So ask yourself, what is your current baseline level across these competencies? And more importantly, which clinical skill are you going to focus on first to start leveling up your practice? The roadmap is laid out right in front of you. Now, it's time to get out there and start practicing. Thanks so much for joining me, and best of luck on your journey.